joined today on Mobile World Live by Alberto Prado, who is head of Philips' Digital Accelerator Unit. Alberto, welcome.
Thank you.
Firstly, tell us, what is Philips' Digital Accelerator Unit?
Well, the Digital Accelerator is all about figuring out, defining, testing and validating what the next generation of new-to-the-world connected solutions looks like for the healthcare and the consumer space. So what we do is, work co-creatively with consumers and hospitals to be able to validate business models, technology feasibility, and the level of relevance of such solutions so that we can invest in productization.
Okay, so it's very much focused on healthcare. The Internet of Things it covers many different verticals. Where do you think the industry is in terms of progress from a healthcare perspective in the IoT space?
What you see today very much is about things like connected cars or connected appliances, but what we see in the healthcare system today is that it needs to be fundamentally transformed. And in order for this transformation to take place from volume-based to outcome-based systems, we need to be able to leverage on IoT technologies, software, connectivity, communications, so that we can provide population health management in a much more effective way.
Do you have a big vision for this? I mean, is this something that can dramatically transform people's lives, or is that too far down the road?
Yeah, no, absolutely. I mean, what we see today, if you look at a world's population, it's increasing and aging faster than ever before. The number of chronic and lifestyle-induced conditions is highest than ever, right? And what we see is that healthcare systems are not able to cope with that because they are reactive. They treat illness rather than avoiding illness and by prolonging health. And we see that when it comes to transitioning into a more proactive and more or less fragmented or more integrated care system, that IoT technologies can really become enablers of that. And obviously, once we get there, it will be truly life-changing for a lot of people.
So tell us a little bit about what role do you think the mobile operator can or perhaps should play in this space?
Healthcare used to be a system that when you got ill, you go to a hospital and you get treated. And as we're transitioning from illness management and treatment towards prevention, you need to be able to be monitored and tracked. If you have a certain chronic condition, whether it's COPD, diabetes, you want to be in control of certain vital signs and be reassured that if there is any deterioration, that healthcare professionals are having access to that data, wherever you are, at any given point in time. And that's where cellular networks comes in as an enabler.
How far down that road are we though? Do they understand the opportunity?
We have a couple of solutions that already are leveraging mobile operators networks. Like for example, in the US, we have a partnership with AT&T for an elderly care services proposition. I think what we see going forward is a number of use cases that go from low bandwidth, high availability requirements to really truly mobile broadband, like augmented reality use cases. I mean, we're experimenting with augmented reality enabled wearables to be able to assist people beyond the operating room. So imagine you have a traffic accident and there's an ambulance that comes and the primary caregiver or nurse is there. That person can actually start wearing augmented reality enabled glasses and let it be guided by an expert somewhere in the world on step by step and on what to do in that really truly sensitive first moments after an event of that nature has happened.
Alberto, thanks very much for sharing your thoughts with us. Thank you.